A lady of 45 years feels a small lump in her breast. I explained to her the need to go and have a biopsy of the mass. She's scared. Someone tells her, don't go back to the hospital. Biopsy spreads cancer. Try herbs first. Chemotherapy is actually worse than cancer. You don't have a family history of cancer, so you are fine. 6 months later, she returns. The mass has grown. It is an open wound in her breast. Now it is stage 4. This has happened to me not once, not twice, not 3, many times. Myths don't just mislead, they cost lives. Today, I'm going to confront the 6 common most myths about cancer and the truth that can save you or someone that you love. So if you want to know more, stay tuned and stay with me and stay to the end so that you know what is killing our people. Hi, I'm Dr. Joshua Derito, a family physician focused on public health and cancer prevention and treatment. Here, we break complex science into simple actions that you can apply today. Cancer does not kill because it is aggressive. Sometimes misinformation kills faster. Let's break these myths calmly, clearly, and with evidence. The myth number 1, cancer is a death sentence. This myth creates fear, and fear creates delay. And here is the truth. When detected early, many cancers are highly treatable. Someone told me that screening is like you are looking for disease. But that is not the story. Early stage breast cancer, when diagnosed at this early stage, 90% of ladies, they have more than 90% survival in 5 years globally. At stage 4, survival drops dramatically. Not because of the cancer, but because of the delay in diagnosis and treatment. Cervical cancer can be detected 10 years earlier before it presents as full-blown cancer. It is preventable and it is treatable, completely treatable when detected early. Childhood leukemias, survival has improved massively over the decades. The difference? The stage that the cancer is detected. Early action changes everything. Hopelessness delays diagnosis. Delay changes outcomes. Cancer is serious, but hopelessness is dangerous. Myth number 2. Sugar feeds cancer. Stop sugar and it will shrink. This spreads on WhatsApp, on TikTok, and yes, cancer cells use glucose. But so do brain cells, immune cells, muscles. There's no clinical evidence that eliminating sugar cures cancer. Extreme no carbohydrates diets during treatment can cause dangerous weight loss, weakening immunity, and reduce treatment tolerance. Balanced nutrition supports chemotherapy. Starvation does not cure cancer. If diet alone cured cancer, oncology wards would be empty. The most important thing is go for the whole grains, whole meals, reduce processed meals. That is important. Myth number 3, chemotherapy is worse than cancer. Yes, this myth is powerful and unfortunately deadly. Yes, chemotherapy has side effects: hair loss, fatigue, nausea, but modern oncology has significantly advanced. Today, we can be able to manage the side effects far much better than 10 or 15 years ago. Strong antiemetic medicines for feeling like vomiting, growth factor support, better dosing protocols, scalp cooling options, and even targeted therapy. And it is getting better every day. We have new ways of controlling cancer that are precision, determined to specific individual needs, and they have less side effects. So many patients work and live meaningful life even during their treatment. So side effects are temporary. Untreated cancer progresses. Fear of side effects can cost your life, can increase your complications. Treatment discomfort is not the same as disease progression. Which hand do you want to accommodate? Myth number 4, herbal remedies can cure cancer. This is especially dangerous locally. There is no herbal product proven in rigorous clinical trials to cure cancer. Some herbal products actually interfere with chemotherapy metabolism, damage the liver or the kidneys, delay effective treatment. Complementary care is one thing. Replacing a proven treatment with unproven cures is another. By the time patients return after trying alternative cure, the disease is often advanced and irreversible. Delay cannot be reversed. Always tell your oncologist everything you are taking. It could save your life. It could save your liver. It could save your kidneys. There is no exception. Myth number 5, no family history of cancer, so you can't have cancer. Only 5 to 10% of cancers are strongly hereditary. 5 to 10%. Most cancers are influenced by your lifestyle, your environment, the infections that you get, sometimes just random mutations. In Kenya, infections drive many cancer. Human papillomavirus for cervical cancer, hepatitis B for liver cancer, H. pylori for stomach cancer. No family history does not mean no risk. That is why screening applies to everyone. Myth number 6, biopsy or surgery spreads the cancer. This can cause tragic delays. Routine biopsy spreading cancer is extremely rare, less than 0.01%. In most modern studies, needle track seeding is less than 0.01%. But during biopsy, there is diagnosis. And without diagnosis, there is no treatment plan. The risk of waiting is far greater than the risk of biopsy. Knowledge saves lives. fear delays them. Let's have a reality check. In Kenya, a large proportion